mental retardation. It limits a person's intellectual and adaptive functioning. For example, a person gets a score of 70 in an IQ test. He or she believes to be intellectually disabled. This means that he or she is lower than an average learner.
There are two limitations in intellectual disability. The first one is intellectual function. This refers to the person's ability to learn and to solve the problem. And then the other one is adaptive behavior. This skills refers to the day-to-day life.
By the severity of its symptoms, which are mild, moderate, severe, and profound ID. Children with mild ID has cognitive deficits that impairs their executive function. They're immature in social interactions and need support in personal care and getting organized. Children with moderate ID show significant developmental lag compared to their peers. They communicate differently, and they need support even in recreational activities. Children with severe ID has few conceptual skills and need guidance on problem solving. They only understand simple speech and gestures, unable to make responsible decisions, and needs long-term teaching. Children with profound ID uses concepts involving the physical world, not symbolic processes. They express desires non-verbally and non-symbolically. They usually have physical and sensory impairments and is dependent to others.
Fragile X syndrome is the most common cause of intellectual disabilities that can be inherited. It is caused by a change or mutation in a specific gene on the X chromosome. This gene is called the Fragile X mental retardation 1 gene, or FMR1 gene for short. The FMR1 gene is found in every cell of the body, but the protein it makes is essential for normal brain development. In the case of Fragile X syndrome, the FMR1 gene either does not make this protein or makes too little of it, and so the brain does not develop normally.
Syndrome is a genetic disorder having some degree of developmental delays. These delays can range in severity from mild to moderate. Some of the underlying areas that are affected in development are poor muscle tone, which is affecting strength and endurance, broad, short hands with relatively short fingers, which decreases coordination for both gross motor and fine motor activities. Also, these patients tend to have decreased sensory processing, which impacts successful participation in all environments.
Prader-Willi syndrome is a genetically determined disorder, so it's often nowadays suspected at birth because of this combination of floppiness, failure to thrive, difficulties feeding. But what's striking about children with Prader-Willi syndrome is that as they grow, and as they usually reach 2, 3 or 4 years of age, what happens is the child seems to develop a much greater interest in food. So the child will take as much food as the parents would offer them. And then what happens is you begin to see the child becoming obese. Maybe it's better thinking of it as a syndrome of starvation, in the sense that people with Prader-Willi syndrome are fooled into thinking that they're still hungry, even though they've eaten a large amount of food.
Fetal alcohol spectrum disorder, or FASD, describes a range of effects that can occur in an individual who was prenatally exposed to alcohol. The effects can include physical, mental, behavioral, and learning disabilities. FASD is a lifelong, brain-based disability that impacts individuals, their families, and society. For educators, it is critical to understand that prenatal alcohol exposure may cause a differently structured brain, and that in most cases, no physical or facial characteristics are visible.
You might be wondering, what causes an intellectual disability? There are a wide variety of medical and environmental conditions, including chromosomal or genetic conditions, drug and alcohol use during pregnancy, trauma, health problems, environmental toxins, and unknown causes. One group of causes has to do with genetic conditions. This includes things like Down syndrome and Fragile X syndrome. Other causes happen during pregnancy. An intellectual disability can result when a baby doesn't develop properly inside the mother. This can happen if a woman drinks alcohol or has an infection like rubella during her pregnancy. Drinking during pregnancy in particular can cause various problems that range from mild to severe. This can include learning, emotional and behavioral problems, and the physical problems that affect the heart and other organs. Fetal alcohol syndrome is among the fastest growing known causes of intellectual disability. Another cause is trauma. This can happen if the baby has problems during labor and birth, for example, not getting enough oxygen or being injured during delivery. Also, head injuries from an accident or child abuse may also cause brain damage. Tragically, this is also among the more common known causes. Health problems and diseases such as whooping cough, measles, meningitis, or HIV-related infections, intellectual disabilities can also be caused by inadequate medical care and exposure to poisons like mercury and lead. Finally, unknown causes. This is the largest category of all. In fact, it's larger than all the known causes put together. There's a rule of thumb that people who have milder disabilities are more likely to have an unknown cause for the condition. Intellectual disability is present in all countries, communities, races, and social classes. The common factor for all causes is that something interferes with the growth and development of the brain during the early period of a person's life.
Learning needs. What services are available for people with intellectual disability? School-age children with intellectual disability, including preschoolers, are eligible for special education for free through the public school system. This is mandated by the Individuals with Disabilities Education Act, or IDEA. Parents and educators work together to create an individualized education program, or IEP, which outlines the child's needs and the services the child will receive at school. The point of special education is to make adaptations, accommodations, and modifications that allow a child with an intellectual disability to succeed in the classroom.
The stages of cognitive development of almost every student with mild to moderate intellectual disability. The focus in teaching is to make the curriculum reality-based and relevant. Examples, reading skills should be developed and applied using real books. Accurate information on the computer screens, recipes, brochures, and comic books. In addition, the medium of graded readers, games, and flashcards. For children who are mature enough to use logical thoughts, the concept of learning by doing certainly applies Jimenez and Camry 2013. If they will learn the significant number skills, for example, they should learn it not only from computers, instructional materials, and practice sheets, but also from real-life situations like shopping, outdoor adventures, stock-taking, measuring, estimating, counting, groupings, recording data, and comparing quantities.
Chunking is used commonly when classifying large amount of information. Also, chunking is a strategy